Hi, my name is Peyton Burke, and I'm a University of South Alabama nursing student, and today I'm going to be performing my indwelling catheter insertion checkoff. So the first thing that I would do upon entering my patient's room, I would perform hand hygiene, introduce myself to the patient, and use two identifiers in order to correctly identify the patient as well as any allergies that they may have, comparing those to the MAR, following hospital policy, and then also explaining the procedure to the patient so that they were comfortable with it and that they understood what was going on. Then I would provide privacy for my patient. So next I'm going to don my goggles and perform hand hygiene again before gathering all of my supplies for my patient. And then I would raise the bed to working level and lower a side rail and assist my patient into dorsal recumbent position. In a hospital setting, I would obviously have a real patient. Today I have these leggings with towels in them, and this is going to be representing my legs of my patient, so they're already in dorsal recumbent position. So next I'm going to just set up my sterile field and don my sterile gloves. So I am performing hand hygiene, and I'm going to open my sterile kit. And I'm going to use the packaging as a trash bag. So I'm going to fold the ends over and open it wide to give me enough room to place anything that I'm not going to be using later on into it, to allow for less chance of break in sterility. So I'm just going to set that over here. Next, I'm going to be opening my sterile kit, and I'm going to use aseptic technique and maintaining a 1-inch border. I'm going to open each flap, opening the first flap away from me. After I've done that, I am ready to don my sterile gloves. So I'm going to open my sterile gloves. And I'm also maintaining a 1-inch border for this as well. So I stick my fingers under the sleeve. And I'm going to don my dominant hand first, which is my left hand. And then put my dominant hand under the cuff of my non-dominant hand. And don my second glove. So now I'm going to go back over here, and I'm going to set up my sterile field. So this is a fenestrated drape, and I'm not going to be using it today since it's optional, but you could use this to cover the patient's genitalia. So I'm just going to set that to the side for now. And next I'm going to be placing the waterproof drape underneath my patient's buttocks, and I will be maintaining a 1-inch border for that as well as making sure not to touch the patient at any time with my sterile gloves. So now I'm just going to take the tray and place it closer to the patient. And now I'm going to be demonstrating how to provide perineal care on a male and female patient. So I'm going to move the camera closer. but again, my gloves are still sterile. And I'm going to, normally I would actually open this packaging, but I'm not going to do that today. But I would open it and pour it on top of my cotton balls and dispose of that. So now I'm going to be demonstrating how to perform perineal care on a male and female patient prior to inserting a catheter. So for a female patient, I would for a male and female patient, I would take this iodine solution and I would pour it over top of the cotton balls, and I would take my tweezers and pick up a cotton ball, and for a female patient, I would use my non-dominant hand, which is my right hand, and open the labia and clean top to bottom, outer, dispose of the cotton ball, grab a new one, outer, dispose, and then grab a third one and inner most labia, top to bottom, and dispose of that cotton ball. And then for after doing that, I would make sure not to let the labia close, as that could be a break in sterility prior to inserting the catheter. So for a male patient, I would do the same process with pouring the iodine over the cotton balls, pick up a cotton ball, and clean in a circular motion around the glans penis, and dispose of the cotton ball 3 more times as well before inserting the catheter. So now I'm going to be demonstrating the inflation and deflation of a balloon in the catheter. So for a female patient, I would use my non-dominant hand, which is my right hand, and I would have the labia held open, and I would insert the tubing of the catheter in 1 to 2 inches, and then I would see urine flowing out of the bifurcation tubing, and I would know that that was that the catheter was placed correctly, which would mean that it was safe to inflate the balloon. So to inflate the balloon, I would just push down on the saline and allow the balloon to inflate. And for a male patient, I would insert 5 to 7 inches, and then I would insert more all the way to the bifurcation and inflate the balloon. So to inflate the balloon, I'm just going to push down on the syringe slowly. You can see that the balloon is inflated, and then I would remove the syringe. And so now the balloon is inflated, and I would pull out 1/2 inch so that until there was no tension on the catheter. So then to deflate the balloon, I would reinsert the syringe after aspirating 3 times. And I would pull back about 1/2 of a milliliter, and I would insert and then allow the balloon to deflate. And then remove the syringe. So for this video, I'm going to be demonstrating how to collect a specimen sample in or from a patient with a newly placed catheter, less than a day. So for this one, you can grab your specimen cup and take your lid off, place it facing up, and then you're going to take this outer port of the bag, unclamp it, And without touching that to the inside of your specimen cup, you're going to unclamp, allow urine to flow into the cup until it's full, reclamp it, and then put your cup up here and cover it, and then reclamp. Put your lid on, fasten it tight, and then always label your specimen with the label on the cup and not the lid. So for this portion of the video, I'm going to be demonstrating how to collect a specimen sample from a urinary catheter that's been inserted longer than a day. So you're going to want to obtain the urine from this port, and to do so, you're going to have to clamp off part of the catheter. So you're going to go ahead and use this clamp to ensure that the tubing is clamped off so that the urine will collect into this area. And so once the urine has collected into this area, you're going to, depending on hospital policy, you're going to use something to clean off the area. I'm going to use an alcohol swab today. And you would allow that to dry, making sure that it doesn't touch anything else while it's drying and until you have obtained the sample. So once it's dried, you're going to get a luer lock syringe and pull back enough urine to completely fill the sample cup. And then you're going to get the sample cup and insert the specimen, or insert the urine into the cup without touching the rim or the inside of the cup. And then you're going to place the lid back on the cup, and you'll label it on the cup and not the lid. And then also, before you leave the patient's bedside, you're always going to remember to unclamp the tubing of the catheter so that the urine can flow freely throughout the tubing so that you don't get any backflow. In this video, I'm going to be demonstrating how to properly stabilize a catheter using a stat lock device. So to do so, we need to open our stat lock. And we're going to unlock it. And then you're going to locate the bifurcation and place the device in the stat lock. And click it until it locks. And you always want to make sure that this port is facing up and not poking into the patient's leg, because that can cause a pressure injury. And so to adhere this to the patient's leg, you would use an alcohol swab, or depending on your hospital policy, something to clean off the area of the inner thigh, and then use this adhesive to stick it in place to the patient's leg. And then to undo it, you just push